Okay, you're going to really want to pay attention to this because a lot of you are affected by what we're about to talk about. 60%, in fact, of the adult population will experience some type of gastroesophageal reflux disease, otherwise known as GERD, within a 12-month period. And 20 to 30% of you will have weekly symptoms. That does not feel good. Now, the good news, GERD is preventable. Here to talk about a few healthy lifestyle changes is Dr. Jenny Wilkins, owner of AgeVital Pharmacy Research and Wellness. Nice to have you back.
It's good to be back again.
Let's talk about this. Okay, a lot of people know what acid reflux is, what causes it, and then GERD is the end game when it's gotten so bad that it becomes a disease.
Right. Yep. And how I educate my doctors and our clients is our stomachs are very much like a fish tank. You ever watch Finding Nemo and the fish tries to jump out of the fish tank because it starts to turn green and purple? Well, that can happen with our stomachs. Okay.
So what causes that?
Yep. Bad habits. So bad habits by, drinking too much alcohol, drinking too much coffee, abuse of like NSAIDs, so things like ibuprofen, acetaminophen, aspirin, naproxen, spicy foods, lots of wine. So what is happening is you're reducing the pH of your stomach. So there's that ecosystem. So you have to support the good acid. You have mainstream medicine that keeps telling you, take antacids to get rid of,
because
the
people
pain.
take things like Prilosec or Nexium or any of these antacids, but you're not supposed to take those over a long period of time.
Exactly. Well, they have so many harmful side effects. You can get stomach cancer, and then you have other issues like diverticulitis, diverticulosis. I mean, these are all black box warnings that are on the actual, medications. I mean, the pharmacists, when you go into a pharmacy, any pharmacy, they will give you, the white sheets for, these medications showing you the side effects. Anybody has access to them and is able to read it.
So what are the alternatives then to prevent acid reflux and ultimately GERD?
Right. Well, something super simple is the apple cider vinegar that you can take, maybe about a shot full right before you eat. That's super simple.
For every meal?
So if you have like the heartburn, everybody experiences heartburn at one time or another, and it's very uncomfortable. Some people have it so bad that they feel like they're having heart attacks.
Sure, yeah, they have so much pain.
Right, so much pain. Or then they feel, like food is stuck right here, and then they get burpy and gassy.
Yes.
All right, so what you have to do is increase your pH, take care of that ecosystem, that fish tank, putting, electrolytes in your water, taking probiotics, I mean, probiotics are probably my biggest seller, in my facility. Glutamine powder, okay? Athletes that, load themselves up with glutamine powder.
So glutamine and probiotics, things that you can easily find anywhere, really.
Yeah, well, yep, absolutely.
And when is the best time to take a probiotic, let's say?
People often take probiotics, that are unrefrigerated, and that's 100% wrong. You want to find probiotics that are fully refrigerated, because they're live, active,
live cultures.
Cultures, and those are your little critters in there that are protecting the lining of your stomach, so producing enzymes.
If you have a bad acid reflux problem, can it be repaired quickly?
Oh yeah, it's very easy to repair your stomach lining. That's what the glutamine powder is for. It coats it. It helps you produce that good mucus. And then if you have any, no mucus here in your esophagus, N-acetylcysteine, NAC, it's called NAC, another amino acid. These wonderful amino acids, all biochemical, biochemistry of the body. All natural, right? And you can test for it too. But
because we're not giving up our wine.
Right, I'm not giving wine. Right, I love my coffee. I love my wine. You're Italian, I'm Italian, right?
Exactly. All right, Dr. Jenny, thanks so much. For more ways to prevent GERD, you can reach Dr. Jenny and her team at AgeVital at 888-388-7237 or go to agevital.com. Thanks so much, Doc.
Thank you.
All right, Cindy, over to you.